Great. So I'm pleased to follow this morning's speaker, Dr. Gilberg, and talk about one of these autism plus sort of conditions, because I really think that it's time to kind of think about these things and also how to sort of approach the intervention for these things, because they can have certainly an additive effect in terms of the impairment on our youth with autism spectrum disorder. And so this work really comes out of my postdoctoral fellowship year. So even though I've been focusing on sort of ADHD and tic disorders, my main area of interest in clinical work has been autism spectrum disorders. And so this work, I'm going to be talking about selective mutism and the treatment in an individual with ASD. And this work was also done jointly with Dr. Tarjux and Ms. Ellen Shumka. My postdoctoral fellowship is also supervised by Dr. Melanie McConnell. So today I'd really like to focus on behavioral treatment for selective mutism. And I'd like to look at what that is in the general population, and then I'd like to talk about how we can adapt that type of treatment approach for individuals with autism. And then I'm going to talk about a case that I encountered this year. Of course, I've changed all of the details that this person can't be identified, but I'm going to talk about sort of how I adapted that treatment for this particular youth with ASD. So first I'll situate sort of selective mutism in the larger context of all of these essence disorders or diagnoses. So selective mutism in our diagnostic manual in the 5th edition really is referring to an individual who doesn't speak in a variety of situations in which they're expected to do so. And this is despite the ability to have language. So this is not, I'm not talking about the children who never develop language altogether. These are kids who have some level of language, whether it's a few words or phrase speech or kind of full sentences, and they're not using speech in contexts that are important for speaking. And as with all disorders, there really needs to be an impairment. Otherwise, we wouldn't call it a disorder. So these kids really show up as they'll be able to speak at home with their parents, but when they get to school, they've never spoken to any teacher or any children at school. And you can imagine this can get in the way of things like testing or giving presentations. So these kids might often get really low grades in certain subjects because they're not using language despite their ability to use language. And so there needs to be some sort of impairment there, whether it's in the community or at school. The symptoms need to be around for at least a month, and this can't be the first month of school, as the first month of school is a bit wonky for all of us. And it can't be due to a lack of knowledge of that language or having English as a second language. And it can't better be explained by other kinds of communication disorders. And this is really, selective mutism is categorized under the broad category of anxiety disorder. So it's something for us to pay attention to. We've heard a lot about anxiety disorders and that being comorbid or co-occurring in this population. And this is another one that I just really want to kind of bring your attention to. So how often does selective mutism co-occur in children with ASD? So first, selective mutism, just in the general population, is often missed. A lot of people just think these kids are shy, and they don't really pay enough attention to this. And then in autism, really the short answer is we don't know how often this is really happening in the context of our youth. We know that anxiety is one of the most common co-occurring disorders in individuals with ASD. And there has been a few studies that have shown that developmental disorders broadly, anxiety and selective mutism, tend to co-occur. And Dr. Gilberg actually had done a study in 1997 sort of looking at population-based study of selective mutism, and there is about 7% of children who did get a diagnosis of selective mutism also were showing symptoms of Asperger's disorder. And we know sort of in general, selective mutism in the general population occurs in about 1 in 140-ish children. So what's going on? Why are we missing this in ASD, or why have we not been talking about this? So there's a phenomenon that we've talked about a lot already, is that diagnostic overshadowing. So we have these kids who are not speaking at school to their peers or to their teachers, but these kids are still speaking at home. What happens is teachers will say, oh, that's just their autism. They're not talking to the kids at school because they have autism. And we might be really missing a specific fear of speaking and a specific fear of speaking that can be treatable because we're just saying, oh, they have autism, we're going to not pay attention to that piece. So why am I even here talking about this? Why do I think it's something we want to even pay attention to? We know from the general literature on selective mutism that this is something that just doesn't go away, that you need treatment. Some people think, oh, they're just shy and they'll grow out of it. It turns out you need to target it in order for it to get better. And these kids are in this sort of negative reinforcement cycle. And what I mean by that is that these kids, so a parent might ask a child, or a teacher might ask a child, do you want to eat your lunch? And so there's a question, there's a demand, the child's anxiety goes up because they're really afraid to answer that question, and then there's no answer given, and then the teacher would likely give the child their lunch without using language, so then their anxiety all of a sudden goes down, they still get the food that they want, and then we sort of have this cycle where the child never learns that they can face their feared situation, which is speaking, to get what they want. And in fact, the whole environment is adapted so that the child doesn't need to keep using language and never needs to face that fear. So we're really trying to break that. And then you can imagine a child who, we've worked really hard in autism intervention. I spent a lot of time in early intervention, and I worked really hard to get kids to actually use words and use language and do these applied behavioral analytic approaches to get them to use language. And so then if they're not using the language that they do acquire, once they reach school, they're missing all sorts of opportunities to interact with their peers, and those lags become greater and greater and greater. So the core deficits are already there, and then there's just layers onto the core deficits that we already see in autism. And then, selective mutism in the general population is usually, the onset is usually around 2 to 5 years of age. And so there's often a really long lag before we even say, hey, this is something more than just shyness and treatment. And then these patterns become much more entrenched.